Preparation before spine surgery directly affects safety and recovery. Preoperative optimization means reducing risks you can control. Nutrition, nicotine, and medications strongly influence complications. These three areas guide most pre-surgery recommendations. Nutrition supports healing, energy, and immune function. Protein is the nutrient that rebuilds tissue after surgery. Low nutrition can delay healing and increase infection risk. Weight loss, fatigue, or poor appetite should be reported. Teams may address nutrition before proceeding with surgery. Nicotine exposure is another major risk factor. Nicotine includes smoking, vaping, and replacement products. Nicotine reduces blood flow and oxygen to healing tissues. This slows wound healing and increases complication risk. Quitting weeks before surgery improves outcomes. Longer quit periods are generally better when possible. Medications are the third area teams review carefully. Some medicines affect bleeding or anesthesia safety. NSAIDs are pain relievers that can increase bleeding risk. Supplements can interfere with anesthesia or clotting. Many patients forget to list non-prescription products. Clinicians decide which medications to stop or continue. Clear communication helps make surgery safer.